This patient presented to my office 1 year ago where she had a fracture dislocation created by a Charcot event. Initially, we focused on infection control by getting bone biopsies, flushing out the wound, and placing an external fixation device. That was placed on for 6 weeks. The device was removed and the foot was stabilized in a cast. CT scan and MRI were ordered to further assess what type of irregularities and pathology was within the lower extremity itself. That did reveal a very comminuted and fragmented talus, which is the bone underneath the ankle joint. Once she was ready for a definitive fixation, the procedure itself was a TTC fusion with an interpositional femoral head. The femoral head had to be shaped to the size and shape of the talus roughly. Once we were satisfied with the actual shape of the talus, we harvested some bone graft from the proximal tibia. This was then packed into the fusion site. Fixation for this case was achieved with 3 long fully threaded screws. One of the major challenges after a major reconstructive surgery like this is really the rehab side of it, getting all the muscles firing accordingly that haven't really been utilized for the last year. At some point, we like to make the transition from a walking boot to a shoe. Typically, I like to utilize an ankle brace to provide a little bit of stability, but also allow the muscles to begin firing and stabilize the foot and ankle. Today's the 3-week mark of her walking in shoes. She has no pain or discomfort whatsoever. I like to take the time to ensure that her biomechanics are correct when she's walking, and I don't see any concerning findings that would be reflective of the procedure itself. A complex reconstructive surgery like this really takes a full year to fully recover and be comfortably walking back in shoes and doing the things that she hasn't done before. Almost a year ago today, the patient was at a very, very high risk for losing her leg. We were able to save it, reconstruct it, and today she is seen walking comfortably.